RSV stands for respiratory syncytial virus, and it is a virus that has been here for a very long time. It is one of the many viruses that cause symptoms we typically see with any other cold. And we usually see it around like the late fall to the early springtime, mostly in the winter time. It is spread through respiratory droplets, so if someone coughs in your face or if you touch a surface that has a virus and you touch your face, then you can get an RSV illness. The symptoms typically are what you would see with other colds, so you can have like cough, you can have runny nose, stuffy nose, fevers, decreased appetite at the beginning of the illness, but then the kids that are younger than age 2, they can have bronchiolitis, which is inflammation of the smaller airways or the bronchioles, and they can have lots of mucus in there. They can also have pneumonia from RSV as well. When your child has those symptoms, call your pediatrician. We're here to help provide any advice. In the beginning of the illness, a lot of the symptoms can be mild, so making sure that your baby is still able to stay hydrated by suctioning their nose if they're very congested, because they're not going to be very interested in feeding if they're having stuffy nose. And you can use nasal saline, you can suction, and then just kind of monitoring for any progression of the symptoms or worsening of the symptoms, which typically happen around days 3 to 5 of the illness. And those symptoms would be like symptoms of like struggling to breathe. You would see your baby just like having fast breathing or sucking into the ribs or like grunting. Some younger babies can have pauses in their breathing for like seconds at a time. At that time, I would take your baby to the ER, call 911. Most people have mild symptoms and they will be fine. But there is probably less than 5% of the patients that will end up in the ER and hospitalized. Some do end up in the ICU, and those typically are the kids that are under age 2, or like mostly if they're like very, very young. At the onset of the illness, don't panic. Call your pediatrician if you're concerned about anything, and we can provide you with any recommendations, whether to like start with treatment with our guidance from home. And then we could also recommend coming to our clinic or doing video visits or going to the ER. So as with any other cold, I would just make sure you wash your hands frequently, and then also avoid touching your face too much, because that's where viruses can enter your body, so through your eyes, your nose, and your mouth. You can wear a mask if you want when you're out in crowded places, and then just sanitize your surfaces very frequently. And then if you have other children at home who are even showing the beginning signs of symptoms of cold, I would just maybe isolate them from the rest of the family who can get like the younger children sick or the rest of the family sick.